So, hello everyone, and welcome to the very first episode of the RISE-MICCAI storytelling series, where we highlight powerful journeys of researchers all around the world in the MICCAI area. I'm Pooja, a clinician and researcher from IIT Kharagpur, and I'm joined by two brilliant co-hosts, Nina pursuing her PhD at Technical University of Denmark, and Santosh, a research scientist at DKFC. Today, we are honored to feature a guest who truly embodies what it means to rise. Meet Dr. Andrea Lara, a trailblazer in biomedical engineering and our very own active member of the RISE-MICCAI board. Her journey is nothing short of remarkable. Just to tell a few words about her, she's the director of the first ever biomedical engineering program in Guatemala at the Universidad Galileo, and she leads the biomed lab at the same place and is working on impactful AI-based solutions such as fetal ultrasound screening in rural Guatemala, stroke detection aid system, and an AI system to detect sinus abnormalities. Beyond research, she has been a strong advocate for women in STEM, having served as the president of IEEE Women in Engineering Guatemala, leading national outreach and mentoring programs. She's also made significant contributions to the MICCAI community in the recent years, including serving as the general chair of CIPAM 2024, organizing Med NeurIPS and other workshops and competitions at MICCAI, and reviewer for the journal Artificial Intelligence in Medicine. She's also obviously an early member of the RISE-MICCAI board, where she currently leads public outreach. I don't want to give everything out right away. Let's keep the suspense and let's hear more about her incredible journey and contributions. But first, Andrea, welcome to the show. It's an honor to have you here. How are you feeling today?
Oh, well, first of all, thank you for the invitation. Yeah, I'm feeling well, thank you.
Great. So to kick things off and get right to the point, could you share a little bit more about your journey? How did you start off in your career, and what drew you towards the MICCAI field in particular?
Yeah, sure. So my journey has been interesting. So I started with a bachelor in electronics, and since I was in high school, I knew I want to study biomedical engineering, but that did not exist in Guatemala. So I decided, okay, I should go on another way. So I decided to do a bachelor's in electronics, try to get all this knowledge, and then try to apply it to biomedical. And since that didn't exist, I had to go abroad. So I did a master's in biomedical engineering in Germany. And then, I came back from that master, and I wasn't sure what I was going to do. So I was like, okay, now I have the master. Now what? And then I created this program, and yeah, we have been working on the biomedical, the academic program, and then the research that has been something that we have been doing so far.
Wow, that's great. I mean, it's really nice that you knew what you wanted to do and you pursued it irrespective of the location. That's really nice. So back in 2010, you were just starting out as a first-year student at the university, like you told. And now you've returned back to the same university as a faculty member. So how does that feel, and what advice do you give to other researchers from different countries who want to go back to their home place and start their practice?
Well, it has been challenging, I guess, and also like really rewarding, because I got to really use the knowledge that I acquired during my master and doing my PhD to really focus on the problems that we have here in Guatemala. So it's really nice when you get to really apply what you learn in the specific tasks that you have in your country. However, it's not that easy. So in my case, has been really challenging because, as I mentioned, this program didn't exist. So I have to knock a lot of doors to ask them, like, okay, we are starting this program. We want to collaborate. We want to do research. And I got a lot of rejections. So I guess one advice I will give is, okay, you're going to be rejected, but that doesn't mean that you cannot, go forward. So I from my side, I guess if you're interested in following this path, I can tell you in advance that could be really rewarding because then you get to not only see how can you apply all this knowledge, but also teach other students that are in the same path and show them that this is something that you can do in your own country. Because especially here, you usually think like, yeah, this is something that I might get to do in, I don't know, the US, Europe, I don't know. But then now seeing like you can apply it here, that is something that really motivates them to be in their country and work on that.
That's nice. Nice to know that, you did your best to get it done, I think. So, coming to mentorship, I'm sure you've had a tough journey. And in this journey so far, who are the people who really helped you change your course, who lifted you up, and who could help open a lot of doors for you?
So in my case, I have to say the rector of this university, he from the beginning was really supporting all the plan because when I finished my bachelor, I told him like I want to go to Germany and study, and he's like, "Oh yeah, do it, please do it. Let me help us at the university. Let help you to get this done." And then when I came back, he was the one who opened the doors to starting this program, and he said to me like, okay, we have this challenge that is open this academic program. It's going to be challenging because you have to work with engineers, which usually there are not many women, and also with medical doctors that also can be quite challenging. But he was there to support me. So I guess he has been really a mentor to me through all my career, not only on the professional, but also on the other side, like really supporting that. Yeah, it was going to be challenging.
Nice. I think you got a little lucky in that you got a good mentor for yourself.
Yeah, I have to say that, yes.
But for our listeners, who are starting out, what advice would you give to find such mentors to reach out and make such connections?
Yeah, I guess like spaces like RISE-MICCAI or even MICCAI, there is a good place where you can do network. In my case, I have met a lot of professors that are working well in different areas, but they have opened like different opportunities. For example, I got to be in the RISE because I met Islam Rakik, during a virtual MICCAI. So I write to her and told her like, yeah, I'm from Guatemala. I would like to learn more. And that was when she was in woman in Mikai, so not even rice. And then she got back to me and she said, okay, I have this project. We want to create rice. Do you want to be a part of it? And I guess this is something that really helps. So I guess one advice I will say is talk to the people. Yeah, like people are really open to collaborate, and even though you think like, yeah, this big professor, it doesn't matter. Like they're really open to help, and yeah, this has been my experience. And yeah, of course, if you come to me or to one of my colleagues, we will be really happy to help you because we have been there. So we know how it is. And I guess most of the professors also have been there. So yeah, that will be my advice. Just go and talk to them.
Yeah, I think that's the best advice. And I think a lot of the recent programs, to find the mentor-mentee relationships and things that is organized by MICCAI, by Rise MICCAI, I think those will be really useful for young researchers. So, coming to my next question, your CV highlights a lot of socially impactful research, such as, NatalIA, if I'm pronouncing it correctly, AI-driven solution for fetal ultrasound in rural areas. So, how do you come up with these projects and with these ideas, and what made you feel like you want to take up such socially impactful research?
Yeah, so this has been something that we have been working in collaboration with my group. It's not like it was my idea. This is something that we work together. But then I guess it goes back to the thing that I mentioned that is like how can I apply all this knowledge to the real problems that we have here. And that's how Natalia
Sorry.
came up because no, no, don't worry. It's because it's like Spanish. So NatalIA from artificial intelligence, but in Spanish.
Oh,
So
okay.
inteligencia artificial.
Does it
Yeah.
mean something in Spanish?
Yeah, so Natal, so from how do you say natality? I don't know if that's the right word.
Oh,
Like
okay, like
or
natal,
yeah,
natal. Yeah, yeah, got it.
yeah, exactly, exactly, and yeah, in Spanish. So yeah, so this was an idea from one of my colleagues because he comes from a rural area and he was telling that like, yeah, this is the numbers that we have about um, oh, fetal and maternity mortality are really high. And it's like, okay, what can we do about it? So it's like, okay, we know about medical imaging, we know about AI. We know that, for example, in rural areas, the most powerful, let's say, like assistant is the midwife. So we say, okay, if we want to do something impactful, we have to work with them. And that's how like the whole project has started. So it has been a really nice project because the idea is to provide to the midwives that are in these specific rural areas with ultrasound, a portable ultrasound, and allow them to perform ultrasound studies and then connect them with the obstetricians of the specialists that are usually in the city. So somehow the project is more related on how to close that gap that already exists. Most of these women don't go to this specialist because not only because of traveling, but also because of economics or language barriers, because we speak 22 languages here. So there are other barriers that we usually don't think about. And that's how it's like, okay, this is really impactful because we understand the problem. We understand our community. So how can we help them?
That's really inspiring that, you have gone out to people in your community and you're trying to solve problems for them instead of looking at very advanced fields which won't be useful in your countries. So that's really nice.
Yeah.
Yeah. And I also saw and I have seen from many years that you are involved in a lot of leadership and advocacy roles, like in RISE-MICCAI, in Women in MICCAI, and many more. What drives you to take up such responsibilities, and how have they helped you shape your journey as a researcher, as a mentor, and in the academic community?
I think the main reason is like to give back because I have been really lucky to meet a lot of mentors in like engineering and at MICCAI and also as a woman. So I now that I'm on this side, I really feel like I want to give back and help them also to do the what they're like aiming for. So for example, if something related to engineering or if it's something about career path or anyway, because I have been there and I had the help from other professors and I think that is something that it really motivates me like to see like all these young students and like a few years ago I gave a talk in one high school and they were not really paying attention, okay? So I was like, okay, I don't know why I'm doing this and I was unmotivated. But then I met one girl here at the university, and she told me like, because I watched your talk, I got so motivated, and I got into electronics engineering like you did, and then I want to do the master program, but because it really motivated me, and then that's what I said. Okay, this is worth it. At least one, if I could make that impact in one person, it's like it's all worth it. So yeah, that's why I'm really active on this area.
Nice, nice. That must have felt like a really good moment, right?
Oh yeah, I was like crying.
Yeah, that's nice. So I think that's it from me about the questions, but I will ask Nina and Santosh if they have anything because they've been patiently waiting. I would say don't miss your chance. Ask Andrea what you want to ask.
Yeah, thank you so much. Like I was like really not just being patient. I was like really like focusing on listening to the story because though we've been working together, but it's the first time I actually hear you talking about your journey. One thing that makes me particular interested is that you're saying, like in Guatemala, you don't really have the subject or the study program about medical imaging engineering, let's say. And then I'm very, very interested in like maybe can you tell us a little bit about like how to actually start a new I guess it's more likely a study line, right? Like a study program. Like how is it like to study, something like that from 0 to 1? Like what kind of maybe share us a little bit interesting story that you have been through.
Yeah, sure. I'm gonna say challenging. That's the word that defines that. So, but yeah, I mean, so I came back, and I guess it was not only let's say that the academic program didn't exist, but also like the industry that we're not creating or developing medical technology. So the challenge was like, okay, why this is necessary? Why would you help yeah, like have this academic program since there's no, so that's what they were saying, there is no workspace or like where they're gonna go after they done their master. But the thing is that we say, okay, but we have hospitals, we have clinics, we have where we are using all this technology, and you have to learn how to use it, like how this technology is developed and everything. That then can you apply all this knowledge, and that's how we started. So we started like knocking doors, talking to the to the hospitals, to some doctors, and saying, okay, you need a biomedical engineer in your hospital. So that's something that we started working on. We did a lot of like talks and different meetings with these people to show them that this was necessary. And then another interesting part is that here in Guatemala we develop a lot of software. So we are doing a lot of software development. And that's when we said, okay, how can we, now that we are developing a lot of software, like focus in an area that is related to health? And that's how we started with all the medical imaging. So in our master, we created a 1 year program where they can start learning how to do medical imaging analysis. And yeah, and this has been really interesting because now the students, like they not only learn this, but also they have they have done some works that have been presented in different conference. And this is something that didn't exist. Like this was like completely new. And now, like last year, we had the CIPAIM, which is a conference from Latin America related to biomedical engineering and also to medical imaging. And they got the opportunity to present their work. And that, you don't know, like for me, it was like so rewarding because I got to see, like, okay, all this work that I had been done, it's having a result. And the result was
Having an
seeing
impact.
them, yeah, exactly, and presenting the work. And yeah, I felt like a mom, like seeing my son, like I was so proud. Yeah,
Yeah,
because I mean, if you tell me like, I mean, this has been for almost 8 years. So 8 years ago, this will happen in Guatemala. I would say no, I don't think so. That is, yeah. And now here we are. So yeah, but has been challenging.
yeah. It's so interesting because you were saying that first, like when you want to study this, they were actually questioning like what can the students do after they, like after they complete their study, like what can they do? So I feel like it is much more than just the education part because you're actually maybe like boosting an industry, right, at the end. So yeah. Very interesting. I'm so exciting to hear more. Like maybe, like we talk to you again, like in 5 years, in 10 years, and then we see what happened.
Oh, we'll see. Thanks.
Yeah.
Okay, so Santosh, do you have anything to ask or
Uh, Yeah, thanks for the great insights, Andrea. So I think my question is more in the
Mhm.
direction of Mikai. So I personally know that, since the inception of MICCAI, MICCAI played the key role in the AI in the medical imaging since last couple of years. And also I see that you're part of the RISE MICCAI. So as a bachelor student or as a master student, getting directly an entry into the MICCAI is a bit tough. But how do you think as a board member of RISE can contribute or shape a bachelor student or a master student into the MICCAI standard? How RISE can contribute to that as a board member? How do you feel that since your last year experience? I think this will motivate millions of students across the globe.
Yeah, I mean, Rice has been doing a lot of work on, especially that part, on how to motivate them to like follow a career path in medical imaging. And we are working a lot on creating these programs like workshops or summer school or tutorials that are online and free. So we want to give them the tools and show them that is something that they can get and they don't have to travel, because usually from LMIC, that is the biggest problem. Like, how do I get the funding for traveling and everything? So the idea is to give them all these on a virtual. So this is something that we are really working on. And I have seen how students, for example, at master level, they're really using this knowledge and applying them to start, like, at least getting interested on doing research on some specific areas. So we have been doing like let's say like basic level to higher level knowledge tutorials or workshops. And the idea is that so they can get all this knowledge and they don't have to, yeah, they don't have other barriers that they usually have. So yes, this is something that we're really working at the RISE. And yeah.
Okay, so that means RISE could be the best starting point for a bachelor student or a master student to get into the MICCAI.
Yeah. And we have a lot of like events, also like this is a on-site event, but also like the launch where we can all meet and then we can start collaborating. So I really think this is a really good initiative that they can be part of. And especially this year, since we have the summer school and we have the mentor program, this is a great opportunity for these bachelor's or master students to get in. Yeah.
Okay, then I think we can wrap up, but just before ending, we can have a quick rapid fire round. I'll ask you a few short questions to just end in a fun way. You can answer without thinking a lot, and I won't ask you anything back. So, starting off with something very simple, what is a book or podcast that has changed you?
Oh, now I have so many ideas. Okay, let's say something fast. Atomic Habits.
Sorry, I didn't get you.
Oh, Atomic Habits.
Oh, okay. Nice one.
Yeah.
The next one is which women in STEM do you truly admire?
Oh, I have to say Islam. I have known her story and yeah, it's so inspiring. Yeah.
Yeah, I agree. What is one tool every young researcher should learn?
Oh, sorry, again?
What is one tool every young researcher should learn?
Oh, a tool. I don't know. I'm more thinking like
Does anyone else want to
a
take
tool.
up this question?
Yeah, my mind is not coming. A tool. I don't know, something related to programming. I don't know. No, I don't know.
A software tool, productivity tool?
Yeah, I guess. Yeah, it depends on everybody. So
Okay.
I guess I'm gonna skip this
Okay.
because I have to think about it.
Okay, got it. One part of your work that you absolutely hate?
Administrative part. Oh, the administrative. Nah.
Good, you told it out loud. What is your best MICCAI memory?
Oh, I have many, but I think last year when we all sat and for the gala dinner, and we were like, yeah, just having fun with different members and yeah, sharing. Yeah.
Mhm. That's nice. paper rejection or grant rejection, which stings more?
Ooh, both. But I guess I have been on both sides, so let's say grant.
I think you're there right now. I think for a student,
Mm.
it's more a paper rejection.
Yeah.
Yeah. What does RISE mean to you, and what is one line you would like to leave our audience with?
It's about community. So creating community and working together and really help each other, especially because we are all on similar situations and we together can, like we say, we can all rise together. So I guess that's it for me.
That's great. Thank you so much. Andrea, thank you once again for sharing your incredible story with us. Your journey is truly inspiring, and your work is paving way for future generation of researchers, from a lot of underrepresented regions. And thank you to Nina and Santosh for co-hosting with me today. I think if we don't have any other questions to raise, I think we can end today. At a good note, stay tuned for more stories from the RISE-MICCAI storytelling series. And until next time, keep rising is what I want to say.